Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Ariel, an exercise oncology educator, and today's conversation is on chemo-induced peripheral neuropathy and how to keep moving safely. Stick around following our conversation for some gentle movement. The information in this video is for educational purposes only, and it's important to consult with your medical care team for more in-depth guidance and advice. Let's get started. Peripheral neuropathy is a condition where the network of nerves that carry signals between the brain, spinal cord, and the rest of the body become damaged. When these signals are disrupted, it can interfere with how the body moves, feels, and even how automatic functions work. Symptoms can vary depending on which nerves are affected. Damage to the sensory nerves can cause numbness or tingling, and even pins and needles feeling. Motor nerve involvement can cause muscle weakness and loss of coordination. And when autonomic nerves are impacted, it can lead to issues with digestion, bladder control, and blood pressure regulation. And peripheral neuropathy can arise for several reasons, including trauma, infections, certain medications, diabetes, or even inherited conditions. Chemotherapy-induced peripheral neuropathy, or CIPN, is one of the most common neurological side effects caused by exposure to certain chemotherapy drugs. These chemotherapy drugs are listed here on the slides, and 68% of patients receiving neurotoxic chemotherapy will experience CIPN within the first month of treatment. The severity can vary, but symptoms often interfere with daily function and quality of life. CIPN can affect more than just the nerves and the muscles. It can have a wide-ranging impact on a patient's quality of life. If you are experiencing any symptoms of CIPN, talk with your medical care team as soon as possible to get the help that you need. You may be experiencing poor sleep or persistent fatigue, and even low mood due to the stress and frustrations of dealing with new limitations. You may notice that you are starting to lose independence as daily tasks become harder, and you may start to have trouble with fine or gross motor skills, increasing the risk of injury or falls. And this can have an impact on chemotherapy tolerability. It can lead to treatment interruptions, dose reductions, early discontinuation, which potentially can affect treatment effectiveness and survival outcomes. You want to make sure that you're being as safe as possible. If you have neuropathy in your hands, be cautious around knives, scissors, box cutters, or any sharp objects. Using a cane, walker, or handrail if you are becoming more unsteady. And a recommendation that I would give is to look at your feet once a day to see if you have any open sores or injuries. And always wear shoes that cover your whole foot when walking, even at home, but be sure that the shoe is not too tight. And if you are having any trouble, finding the right shoe for you, I recommend you talk with your care team who can point you in the right direction on who to go talk to so that you can have better support and comfortability when walking. So we want to lessen the pain and lower the risk of further nerve damage. So simple lifestyle adjustments can help protect your nerves and reduce discomfort. And even the smallest of changes can make a difference. Wear warm, dry clothing in the cold weather. Take breaks in the cold because it helps reduce exposure to extreme temperatures. Protect your hands and feet by wearing thick socks and gloves, and limit or avoid caffeine as it can temporarily cause blood vessels to narrow. And when blood vessels narrow or constrict, that means that blood flow slows down and blood pressure increases. The heart has to work harder to pump blood through those tighter vessels, which is why experts recommend limiting caffeine, especially before an outing. And especially if you have pre-existing high blood pressure. This slide is a continuation of the slide beforehand. Try not to smoke. Cigarette smoke can cause slow circulation. Limiting alcohol excessive consumption can lead to a vitamin deficiency, leading to damage to the peripheral nerves. One thing that could help is getting a massage or use flexible splints for support, and exercise. It helps improve whole body circulation, and actually in recent studies have shown that exercise therapy has a positive impact on reducing CIPN symptoms and can also improve quality of life, balance, and activity levels. So you might be wondering, how does exercise help chemo-induced peripheral neuropathy? Well, exercise holds potential to alleviate both the physiological and psychological burdens of CIPN. Strength, aerobic, and balance training can help alleviate, stabilize, and prevent CIPN symptoms, improving overall quality of life. Research indicates that this benefit may arise through mechanisms such as increased expression of neurotropic factors, reduction of oxidative markers, and increased release of anti-inflammatory cytokines that improve mood, reduce distress, and increase self-efficacy. Platinum-based chemotherapies damage mitochondrial DNA, leading to oxidative stress. Aerobic exercise enhances mitochondrial function and reduces this damage. Movement encourages nerve growth and helps protect them from breaking down. And exercise increases the production of proteins that support the development and survival of neurons. Types of exercise that are safe and effective for chemo-induced peripheral neuropathy are aerobic exercise. This is because it improves blood flow, reduces fatigue, and helps nerve health. And it is recommended that individuals should aim for 20 to 30 minutes, 3 to 5 days per week. Strength training. This preserves muscle strength, supports joint stability and mobility, and it is recommended to do at least 2 to 3 sessions per week, 8 to 12 reps for each major muscle group, which is your chest, your back, your legs, your arms, and your core. To continue on the last slide on what types of exercises are most beneficial, balance, because it lowers fall risk and retains nerve muscle connection. It is recommended to aim for 20 to 30 minutes, 3 to 5 days per week. And stretching and yoga. This is because it reduces stiffness and it supports flexibility and relaxation and improves sleep. And it is recommended to aim for 5 to 15 minutes daily. And lastly, I want to just provide you with a few more safe exercise recommendations. For your hands and feet, you can do some gentle stretches or massages, use light weights or resistance bands, and circulation exercises from wrist circles, ankle circles, press the gas pedal, lift your foot up off the gas pedal, is always good for your lower body. For balance and strength, remember to, use a chair or wall to support your balance exercises if you're a little unsteady. You can do sit-to-stands or squats. Sit-to-stands are most beneficial for those people who are unable to do a squat properly and need that extra assistance with the chair. And then slow walking on flat surfaces. Thanks for tuning in today. I hope the information I have covered has brought you clarity, comfort, and encouragement. Your health and well-being are what matters most, so please continue to take care of yourself and holding on to hope. Now let's transition into gentle movement. Today's routine is a sample from our Maple Tree On Demand library that is located on our Maple Tree Cancer Alliance app. We do have a subscription, either monthly or yearly, to access safe, empowering exercise videos for every stage of the cancer journey. If you are ready to join today, click the link in the description below or scan the QR code to get started.
Hi, I'm Jessica, your exercise oncology instructor with Maple Tree Cancer Alliance. Welcome to week 9 of our general program for neuro-oncology. Safety is our top priority in this program. Please exercise caution with all movements. If you're feeling off balance at any time, please sit and attempt the exercises seated. If you find an exercise that doesn't serve you, go back to a previous exercise or wait until we do something that's better for you. Today, all we'll need is a sturdy chair and optional dumbbells. Let's get started. Begin in your chair, and we'll have our shoulders over our hips and ankles underneath our knees. So spine is long and tall. Inhale, reach your arms up overhead. Gaze up towards your thumbs if that feels good. And exhale, bring it down. Inhale, reach it up. Exhale, bring it down. One more time, inhale, bring it up. Exhale, bring it down. This time we'll come from the side. Inhale, reach it up. Exhale, down. Inhale, reach. Exhale, down. One more. Inhale, reach. Exhale, down. This time, let's clasp our hands together. Reach it out in front of your chest. Have a slight rounding in your upper back. And if it feels okay, turn your palms out. Inhale, reach it up. Take just a few breaths here, shoulders away from your ears. Pressing your palms up into the ceiling. And exhale, lower your arms down. Let's bring our arms in front of us, palms face down. Bring your fingertips up towards the ceiling and down to the floor. Towards the ceiling and down. Continuing to bring in some movement to our wrist here. And then we'll stand up and we're gonna find a quad stretch. So if we have our balance, we can either take one leg behind us and find our quad stretch, or we can take our foot onto the chair, step forward just a little bit, bend down until you find your stretch here in your leg. Couple breaths. And then we'll switch to the other side. Go ahead and release. And we'll take our left hand onto the chair, hinge at your hips just a little bit, and right arm hangs heavy. So there's no work for our right arm to do, muscles are relaxed. And we're just gonna make tiny circles starting from our shoulder in one direction. Arm is as relaxed as possible. Maybe the circles get a little bit bigger. And then we'll switch directions, starting off small, and then getting a little bit bigger. We'll rise up, and then we'll switch to the other side. Taking your right hand to the chair, hinge at the hips, left arm hangs heavy. And starting out from your shoulder, make tiny circles. Maybe they get a little bit bigger. And then we'll switch directions. And we'll rise back up, come back to our seat. This first exercise will be seated, and we're going to do seated high knees. So we're going to do 2 sets of 10. We're going to lift up one knee as high as we can with our core engaged and spine still tall. So hands can be at the hips or hanging onto the chair for support. And we're just going to alternate our knees. When you're ready, we'll start with right knee up high, lower it, left knee, and down. Continue it. This is 2, 3, 4, 5, halfway, 6, 7, 8, 9, 10. Rest. And we've got just one more set of 10 to go. So we'll start with the right knee again. Lifting it, lower, left knee, and lower. This is 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great job. Go ahead and scoot a little closer towards the edge of your chair if you're not already. And we'll take our right leg in front of us. So leg is straight. Hang on to the chair if you'd like some stability. Spine is long, chest is open. And we're going to lift our right leg. You can point your toe, and we're just going to make tiny circles here. And switch directions. Release. And we'll switch to the left leg. Left leg out, point your toes, and we'll do tiny circles. Switch directions. One more time each side. Bring your right leg out, tiny circles. Switch directions. Other leg. Tiny circles. Switch. And release. We will come into a squat next, or a sit to stand. So if we're doing the sit to stand, feet will be flat on the floor. Hands can be at our hips. We're going to push off with our feet, core engaged, to stand up, and then lower back down to the chair. You can always hang on for some extra stability. We will do 2 sets, or we'll do 3 sets of 10 here. And if you'd like to just go in and out of a regular squat, coming down, knees stay behind toes, and lifting, you are welcome to do this as well. So wherever you're at, we are going to lower to a squat or the chair and lift up for 1, 2, 3, 4, 5, halfway, 6, 7, 8, 9, and 10. Take a moment, catch your breath. If you are doing the squats without the chair, I do suggest holding your squat in the down position for just a second or 2. And when you're ready, we'll start again for our second set. Go ahead and lower and lift up for 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Catch your breath, shake out your legs. We've got just 1 more set to go. When you're ready, we'll come on down and up for 1, 2, 3, 4, 5, 6, 7, almost there, 8, 9, 1 more, and 10. Shake it out. But if you do have a dumbbell and would like to use that, we are going to use that next. We're just going to do some single arm bicep curls. If you do not have a dumbbell, or if you don't wish to use one, you can still do the movements and it'll still have benefits. So let's start with the right arm. We are going to do 3 sets of 10 for each side. If you have your dumbbell, palm will face forward. And we're just going to bend the elbow, bring your hand towards your shoulder, and back down for 1, 2, 3. You can do this seated if you'd like. 4, 5, 6, 7, 8, 9, and 10. We'll go ahead and switch sides. As you do these, try and keep your core stable and your spine neutral. We're going to lift our hand towards our shoulder and down for 1. Try and keep your wrist stable here. So we don't want our wrist flopping all around. So keep it nice and strong. Lift up and down for 2, 3, 4, 5, 6, 7, 8, 9, and 10. We'll switch back to the right side. Lift up and down for 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Switch to the left. Lift up for 1, 2, 3, 4, 5, halfway, 6, 7, 8, 9, and 10. One more time each side. And if you have a heavier dumbbell or if your arms are feeling tired, just make sure that we're not using our body to lift it up there. So try and keep your body neutral and stable. We'll lift up and down for 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, 10. Switch to the left side, last time. Lift up and down for 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. Good. If you're using a weight, go ahead and put that away. That'll be the last time we use that in this workout. And we're going to come into a lunge. So bring your right foot forward, left leg back. If you're feeling a little off balance, take hold of your chair or the wall. And we are going to stick with 3 sets of 10. So we're going to do 3 times 10 here. And we're just going to bend both knees, keep your knee behind your toes, and lift up. That'll be 1. And we're just going to keep doing it each side. When you're ready, we'll lower and lift for 1. Keep it going. 2, 3, 4, 5, halfway, 6, 7, 8, 9, and 10. Shake it out. And then we'll switch to the next side. Left foot forward. Find your stance. Bend into both knees and lift for 1, 2, 3, 4, 5, 6, 7, 8, 9, last one, 10. Shake it out. And we'll go back to the right side. Lower down and up for 1, 2, 3, 4, 5, 6, 7, almost there, 8, 9, last one, 10. Shake it out, and then left side. Lower down and up for 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Shake it out one more time each side. Catch your breath. And then we'll start with the right leg forward. Bring it down and up for 1, 2, 3, 4, 5, 6, almost there, 7, 8, 9, and 10. Last one. Shake it out. One more time on the left side. Bring it down and up for 1, 2, 3, 4, 5, 6, almost there, 7, 8, 9, and 10. Shake it out. Great job. Catch your breath. Deep breath in and out. One more time. Deep breath in and out. These next exercises will be shadow boxing. So what you get into it will be what you put into it, or what you get out of it. So the harder you go, the more intense it is. And you can also make it super light. So the first exercise that we're gonna do is these speed bag punches. So our arms are gonna be up around face height. And we're just going to circle our arms, pretending like we're punching that bag. When you're ready, we'll start. And release. Now our next exercise will be our jabs to our cross punch. So if our left leg is in front, then we're going to take our left arm, punch it out straight out in front of our left shoulder. So our palm is going to turn down as we punch out. Our cross punch will be our right arm, and we're going to punch it as your back heel lifts. So you're going to use the power from your hip. You're going to turn it out and punch. When you're ready, we'll do about 10 here. We're going to use our left arm, if our left leg is in front, jab, cross punch, jab, cross punch. Keep it going. This is 3, 4, 5, 6, 7, 8, 9, and 10. Good, shake it out. And then our next one will be our uppercuts. So where your stance is, we're going to imagine like we're going up. And again, you can use your hips here for the momentum. When you're ready, we'll begin. The more intense you do it, the more you'll get out of it. Just a little bit longer. Good. And our next one will be our hooks. So we're going to come from the side here. Boxing stance is when your arms are in front of you, and we'll go to the side. Elbows about shoulder height here. And we'll go ahead and begin. Just a little bit more. And release. We're going to catch our breath, take about a minute rest here. Deep breath in and out. Shake out your arms. And after we catch our breath, then we're going to go through all of that one more time. So if these movements are a little unfamiliar for you, then the more times we do it, the easier it'll become and the more familiar they'll get. A couple more moments here. And when you're ready, we'll go ahead and start again. Find your stance. Arms will come up about face height, and we're going to pretend like we're doing that speed bag. Going as fast as you can here. And release. And we'll go into that jab to cross punch. You can switch your legs here. So jabbing straight out in front of your shoulder, and then cross punch using that hip to drive that momentum. Go ahead and begin. A little bit longer. One more. Good. And then we'll go into our uppercuts. We're just going straight into it. Getting our heart rates up. Just a couple more here. Good, and then we'll go straight into our hooks, coming from the side. A little bit longer. And release. Shake it out. Great job. Catch your breath. If you would like to take a seat, take some water. We're going to be seated for the remainder here. We're going to come into some nice gentle stretches and lower our heart rates. Another deep breath in and out. Go ahead and come to your seat if you haven't already. Inhale, lengthen your spine a little bit longer or taller. And exhale, twist to the right. Inhale, back to center. Exhale, twist to the left. Inhale, center. Exhale to the right. Inhale, center. Exhale to the left. Keep it going. One more time each side. Bring it back to center here. And we're going to take our elbows to our rib cage here. And our arms will be bent. We're going to squeeze our scapula, our shoulder blades together so that our elbows come closer, and then release. Squeeze and release. We're going to do this 10 times. This is 4, 5, 6, 7, 8, 9, and 10. Release your arms, shake it out, bring in some movements, and we're going to do 10 more. So go ahead and set up again, and squeeze, release for 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Release. Good. Spine is tall. Turn your head over to the right and to the left. Turn to the right and to the left. One more time, to the right and to the left. Good. Bring it back to center. Sit a little closer towards the edge of your chair if you're not already. And we'll straighten out our left leg. So toes point up towards the ceiling. Inhale, lengthen up a little bit taller. And exhale, hinge at your hips, come forward, trying to find a stretch in the back of your left leg here. And we are going to stay here for a few seconds. Keep your spine tall, chest lifted. Inhale, bring it back up. And we'll take our right ankle over your left knee. Slowly start to bend your left knee until your foot's on the floor. And you can stay here or gently hinge at your hips, looking for a stretch in your right hip. And we'll stay here a few seconds. Inhale, go ahead and sit up. Release your right leg and straighten out your right leg. Toes point up towards the ceiling. Spine is tall. And exhale, hinge at your hips, lean forward. Find your stretch here. Inhale, start to bring it back up. And we'll take our left ankle over the right knee. Slowly bend your right knee. And if this is enough of a stretch for you, you can stay here or gently hinge forward. And we'll stay here a few seconds. Inhale, bring it up. Release your leg. Thank you so much for joining me this week, and I'll see you next week.